Welcome to the Somatic Tracking Technique. This session lasts about 20 minutes and we'll go through 4 rounds. But if your time is limited, you can also do just the first round. Even that can be effective and it only takes a few minutes. We begin with tuning in. In somatic tracking, we're not trying to change or eliminate the pain. Instead, we're teaching ourselves to respond to it differently. In the technique itself, we'll do 3 rounds, focusing on the main pain area, and then a 4th round, focusing on secondary areas. Gently observe whether you notice any change occurring between rounds. If you do, it means that the pain experience itself is indeed changeable, and that you can influence it by changing how you relate to it. In today's practice, we want to approach the technique with a sense of openness, acceptance, and lightness, and a feeling of curiosity, discovery, self-compassion, and warmth toward the sensations we feel in the body. Let's begin by cultivating a sense of safety, stability, and a healing inner space, supported by the guidance and the technique. It's best to do the practice while sitting comfortably and relaxed, but you can also do it lying down or in any position where you feel at ease. If you feel comfortable, gently close your eyes. If not, simply leave them open. Now take 3 deep, full breaths. Inhale slowly and imagine or feel your belly rising with the in-breath. With each inhale, we draw in relaxation, nourishment, and a sense of stability and safety. With each exhale, naturally and gently, we release tension and emotional weight. Try to inhale through the nose and exhale gently and naturally through the mouth. Each breath in brings calm and stability. Each breath out releases stress and emotional burden. You can even exhale with a gentle sigh, like a sense of relief, to deepen your relaxation even more. Now we'll begin to scan the painful area or areas. And I'll remind you, we're doing this somatic tracking from a mindset of openness, acceptance, curiosity, and warm awareness. We're not trying to change the pain, just to observe and be aware of it. So begin by asking yourself, where is the pain in the body? Where do you feel the unpleasant or uncomfortable sensation? Bring your attention and awareness to that area. Is there a central point where the sensation is most felt? Try now to describe the sensation. Use words like warmth, cold, pressure, pulsing, spinning, stabbing, tingling, spreading, tightening, heaviness, pulling, or anything else that describes what you feel. Now check. Does the pain radiate to other areas? Are there secondary locations in the body that seem connected? If you identify such areas, stay with them for a moment. Observe how it feels in the area where the pain radiates to. Remember, we're learning to be present with discomfort, with an attitude of acceptance, openness, kindness, and even curiosity. Approach this like a gentle investigation. Imagine you're discovering what your body feels with new eyes. Keep asking yourself, what else can I say about this sensation? What does it feel like? Is it pushing, pulling, sharp, hot, cold, spinning, pressing, tingling? Use any descriptive sensory words that help you capture your experience. If you notice a change in sensation compared to a few moments ago, simply note that. It's a sign that the pain is not a fixed phenomenon, but something that can shift, something that can change. Again, focus on your breathing and take a few deep, slow, and gentle breaths. Let's begin a second round now. Reconnect with a sense of safety, gentleness, and self-compassion. Ask yourself again, where is the pain or discomfort in the body? Is there a central point, or maybe several main points? Take one or two deep breaths as you continue exploring the sensation. Let the breath help you stay present with what you feel. Inhale through the nose, exhale through the mouth, naturally and gently. Keep examining. What does the sensation feel like? Hot, cold, pulsing, sharp, contracting, expanding, heavy, pulling, or any other descriptive word. Does the pain radiate to other places? Has it changed location since you last checked? Has anything shifted as you've paid attention to it? Again, remember, we're not trying to change or fix the sensation. We're simply learning to be present with it, with a mindset of acceptance, openness, warmth, and gentle curiosity. If you notice that the sensations are changing, that's completely normal. It reflects their changeable nature. when we meet them with a new energy, open, accepting, and curious, the experience itself becomes more flexible and open to transformation. Let's now move to a third round, again focusing on the main area of pain or discomfort. Deepen within you the sense of safety, gentleness, and self-compassion. See if you can describe it further. Where exactly is it in the body? Stay attentive and aware. Tune in to the core of the sensation. Is there one main place where you feel it? Again, describe the quality of the sensation. Is it warm, cold? Is it pressing, pulsing, or spinning? Maybe stabbing, tingling, spreading, tightening, heavy, or pulling, or anything else you notice. Does it radiate elsewhere? Do you feel it in additional areas? As you describe those sensations, stay calm, aware, open, and attentive. Remember to breathe deeply, slowly, with a relaxed attitude. Now we'll begin a fourth and final round, this time focusing on one of the secondary areas. Pick one of the secondary areas where you feel discomfort and explore how it feels there. Meet this new sensation with presence, with an attitude that is open, warm, curious, and light. Bring a spirit of exploration and kindness to your observation, as if you're a gentle scientist, curious to discover what's happening through new eyes. If you notice a shift or change in the sensation, that's completely fine. It reflects the natural variability of our body's signals. As a final step of the practice, reconnect with the sense of open, warm, accepting awareness that accompanied your practice. Now, gently release your attention from the symptoms or sensations and return to that broader, positive quality of presence. Reconnect to feelings of positivity, warmth, curiosity, alertness, and openness. You might also connect to a sense of safety and inner stability within the body. Let this open and kind awareness gently fill your body, nourishing it and holding it with care. Let it gently enter the areas of pain too, offering nourishment, support, and calm. Allow this awareness to be a source of support and stability, filling your body with feelings of safety and relaxation. Now take 3 more full breath cycles. Inhale through the nose and exhale gently and naturally through the mouth. At your own pace, without effort. Just let the breath happen. And after the third breath, when you're ready, you may slowly open your eyes.